EKG or ECG electrocardiogram is how we measure conduction. And you could use a handout page to draw out your EKG, writing kind of the meaning of all these waves. Our P wave starts at the beginning of atrial contraction and it represents the depolarization of the atria. Our QRS complex starts at the beginning of our ventricular contraction and it represents the depolarization of the ventricles. And our T wave remains, our ventricles remain contracted until the end of the T wave. This represents repolarization of the ventricles. Atrial repol is hidden within the QRS complex, so you typically can't see this on a normal EKG. The R to R interval from one peak to the next peak is the rate of one single cardiac cycle or one heartbeat. The P to Q interval or P to R interval is the depolarization of the atria to the start of ventricular contraction. And the QT interval is the beginning of the QRS complex through the end of the T wave. And it has some approximate times. You don't need to memorize these times for your NPLEX exam. The horizontal calibration lines, when you're looking at an EKG, 10 small lines equal 1 millivolt, which is positive upwards and negative downwards. So it'd be positive up and negative down. So you can see this would equal 10 small lines or 1 millivolt. The vertical calibration lines, one large box here is zero point 0.2 seconds, and one small box would be zero point zero 0.04 seconds. The heart rate from EKG, you could take the reciprocal of the time interval between the R to R, but this is assuming that every R to R interval is relatively equal. For example, if this R to R interval is 0.83 seconds by measuring small boxes, then 60 divided by 0.83, this is times per minute, gives you 72 beats per minute, which is an approximal heart rate.